All right, everyone. Welcome to the fourth annual Maryland Legislative Summit. You got Jimmy on. There we go. So, welcome to the Women's Issues Consumer Rights Panel. Uh, for those not familiar with the Maryland Legislative Coalition, we're a coalition of over 30 grassroots groups across Maryland that have been advocating for legislation for the last 3 years. We're now starting our fourth year. Um, we also have a climate justice wing that is led by Cecilia Plant. This year, they have decided to focus on two bills. One is on the Transit Safety Act, and the other is on the climate solutions. Uh, the w- Climate Justice Wing is actually made up of a coalition of both NGOs and grassroots groups, and they're doing a tremendous job on climate legislation. Um, we also, in this year, in January, why we don't have an environmental panel this year is because it will take place on January 9th and 10th at the Eastern Shore Legislative Environmental Legislative Summit. Uh, and we will have a link. There's a link in the chat to that summit. So we've merged both what Western Shore and East Shore into one a 2-day summit on environment. In the chat, we will have PDFs of the presentations that were of one-sheet documents that were supplied by the presenters this afternoon, which you can download. We will also have links to the Maryland Legislative Coalition website and the Maryland Legislative Coalition Facebook page. And then at the end, if you have any questions for any of the speakers, use ask and their name, preface it with asking their name, so that, because at the end of this presentation this afternoon, we will have a half hour for questions, and we will have a question moderator who will ask any questions that you put in the chat. Don't overwhelm her with too many other things, because we had a little problems this afternoon of being overwhelmed with she being overwhelmed with a lot of stuff in chat. So don't overwhelm the chat too much. I would also like to thank those who helped put together the summit. The former delegate Jimmy Tarlow, who has been tilting at progressive causes a long time. Jess Gorski, Eileen Alex, John Wells, Tom Bryson, and Scott Weber. Yay!
Yay!
So let me turn it over to our first speaker this afternoon, Sandy Bell.
Good afternoon. Thank you to the Maryland Legislative Coalition for putting this summit together, and especially to you, Ed, for helping me get up to speed on the process. I appreciate that. My name is Sandy Bell. I'm the president of the Maryland chapter of the National Organization for Women. We're a grassroots organization that works to get legislation passed to benefit women and their families. We're all unpaid volunteers fighting to live in a world where we control our own bodies and where we are free from discrimination and harassment in the workplace, and a world where we put an end to all forms of violence against women. We are also promoting equality and justice in our society, not only for women, but also for our LGBTQIA+ and Black, Indigenous, people of color communities. Now I would like to introduce Delegate Jocelyn Pena-Melnick from District 21, representing Prince George's and Anne Arundel counties. She has served in the House of Delegates for 13 years and is a good friend to Maryland now. She's going to talk to you about legislation she's planning to introduce in the upcoming session. We will be supporting this legislation along with the Maryland Legislative Agenda for Women and any other bills that support our issues. Please welcome Delegate Pena-Melnick.
Thank you so much, Sandy. It is an honor to be here with all of you. I want to first thank you for the work you do, for your commitment, for your leadership. You know, we legislators put in the bills, right? We're the mouthpiece, but you do the work behind the scenes. And a lot of these bills couldn't pass without your advocacy, and we do not take it for granted. I want to say hello to a lot of my colleagues that are here today. And again, I appreciate the support. So as you know, I sit on the Health Committee, and I have done so for the last 13 years as the Vice Chair of the Health and Government Operations Committee, but I am also the chair of the Subcommittee on Public Health and Minority Disparities. And this is really key, especially for what's going on in our country, in the world, in our state. As you know, we are in the middle of a pandemic. Maryland has 6 million people in 24 jurisdictions, 23 counties in Baltimore City. And the county with the largest number of COVID-19 cases is Prince George's County, which is 63% African American. And the zip code in the entire state with the largest number of COVID-19 cases is the zip code 20783, which is where the immigrant Latino community lives in the Langley Park, Hyattsville, Chilham, Adelphi, New Hampshire area. So it's not a coincidence that the Black and Brown community are feeling the brunt of this pandemic. It is not because of lack of access to care, which that is important. And in Maryland, we are one of the states that created the health exchange. We're also one of the states that expanded Medicaid under Obamacare. And prior to that, we had almost 800,000 people that were uninsured. And because we created the health exchange and we expanded Medicaid, we have reduced the number of uninsured by more than 50%. But the 300 and some thousand people that are left, a lot of them without insurance, are the undocumented community. So as I said, it's not because of lacking access to healthcare. It is because of all those social determinants of health. You know, they live in very crowded places. I know I grew up with my grandparents where there were 17 of us in a 3-bedroom home. So a lot of these community members live in an apartment. And I know families that are 9, 10 of them that are positive in one apartment. Because if you get it, it's very difficult to social distance. It is also because they are essential workers. They work with the public. It is because they make very little money. Minimum wage is not enough. You're talking about 20-something thousand after taxes, less than that. It is because of the environment, a lot of the issues that you care about as well, that they live in these poor communities with poor air. It is because of lack of transportation as well, and education. So you have all those social determinants of health where your zip code determines your outcome. And COVID has certainly highlighted that. So what I am planning on doing with the support of a lot of the colleagues that are here on this call, because you could put in a bill, but the fact is that you can't get it through if your colleagues don't support it, if leadership doesn't support it, if the community doesn't support it like yourself. So what I did was I drafted a bill that will declare racism as a public health crisis in the state of Maryland. It is not a resolution. I'm not interested in that. It is a bill that has measurable goals. It will look at the illnesses that affect us, Black and Brown communities and poor communities, such as cardiovascular illness, such as asthma, diabetes, hypertension, some cancers. It will actually help the Office of Minority Health and Health Disparity, which is very weak, in my opinion, that doesn't have much of a budget. It will actually restructure that office. The bill also requires implicit bias training for all healthcare providers, including nurses. And that is very important because we need to be culturally sensitive as well. Some of the bills, it's a package, will actually connect, create an IT roadmap with all the hospitals and nurses in hospitals so that we can collect the data and we can do a lot of these policies that will be driven basically by the policy and by the data. The policy will be driven by the data that we collect so that we know who's going to the hospitals, what are the illnesses that affect us as well. So I have been working for the last 7 months. I'm bringing everyone together. One of the last Zoom calls that I had looked very much like this one, where I had 27 people. I had the doctors, the nurses, the hospital association, the different boards, and so forth, to try to negotiate on the language for these bills. And we have been able to do that. We're also working on policies for telehealth, because during the state of emergency, the governor allowed certain billing for telehealth, and changed a lot of the regulations. So we want to make sure that a lot of them stay in place, because I believe that is the future and where we're heading as well. These are unprecedented times, difficult times for a lot of people. I know myself, like a lot of my colleagues, every week I find myself doing food distribution, where there's food and diapers. People are really struggling, whether it's with their unemployment or being able, or behavioral health, where the calls for the crisis center have gone up more than 95%.
Yes.
So we have a lot of work to do in this coming session, but I know the leadership is very committed to these issues, committed to finding solutions, to making our life better. I mean, we care, and we do not take it for granted. We know that people are struggling. So you're going to see that a lot of the legislation put forward will reflect the needs of the community. Lastly, I have a bill that will create the Office of Immigrant Affairs for the state of Maryland. And the reason why I'm putting this bill in is because we find ourselves piecemealing a lot of needs in that community. A lot of immigrants actually that are here and are working legally because they are TPS, temporary protection status holders, or DACA. They're able to work in the state of Maryland, and they're able to pay taxes with what is called an ITIN number, which is not a social security number, but it's given to them by the federal government. So they work here legally. And I actually confirm with Peter Franchel that they paid $139 million in taxes last year. But this is the deal. Because they do not possess a social security number, they were not able to file for unemployment because it requires a social security number, and they did not get a stimulus check either. So this particular community is really left at the mercy of nonprofits or people like yourselves that are helping. So that is, in a nutshell, what I'm focusing on. My focus is mostly health, not just immigrant issues, although I am a Black Latina. I represent everyone, but the needs in our communities right now are very clear. And these are the communities that we must, help and work on. I thank you so much for allowing me to address you. It is really an honor. I'm very passionate about this. And if I can work with you and collaborate on different policies, if you need anything, please feel free to call, and I will make myself available. Thank you so much for your advocacy and for your leadership and for your work.
Delegate Pena-Melnick, we don't have bill numbers yet, do we?
Not yet. They're going to be starting next week. I believe there'll be some bill numbers. I have pre-filed 8 of my bills, and a lot of them actually deal with, chronic health conditions, implicit bias, data collection, and I pre-filed them because I have done the work and they're ready to go. And this is going to be a very different session, as you know, where we have to be flexible. A lot of the work will be done virtually. And you'll be able to contribute and testify, but we don't know when someone's going to be, test positive and we're going to have to shut down. So we were urged to put our bills early if we could and try to work them out if we could.
Okay. Yeah, somebody had asked that question, whether we had bill numbers. So
next week.
Thank you.
Thank you.
Thank you so much for doing this.
My pleasure. Thank you for having me.
Thank you, Delegate.
Thank you.
Sandy, do you have anything else? I'm just saying.
No, thank you. No, I
Oh,
don't.
thank you, Sandy. Thank you for being a sponsor of the summit and for your support. We very much appreciate it.
You're quite welcome. It was my pleasure.
Oh, good. Okay, next up we have Emily Scar of the Maryland Purg.
Hi, nice to see everyone. Some familiar faces. Always tough to go after Delegate Pena Melnick, but I'll do my best. My name's Emily Scar. I'm the director of Maryland Purg. If you're not familiar with us, we're the state public interest group. We've been around for about 40 years. We have our Baltimore office where we work statewide, but also do work in Baltimore City and locally across the state. We also have a student-funded and student-directed chapter at the University of Maryland, College Park. And we work on a wide variety of issues. So some of these might go a little bit beyond the topic of women's health and consumer rights and elections, but a lot of them touch on it. We work on issues where there's a specific private interest that's benefiting at the expense of the public, focusing a lot on public health issues, consumer protection, and our right to fully participate in a democratic society. So I wanted to highlight just a handful of our top priority bills for you. And then I will hopefully be around through the whole thing to answer questions at the end, but I have two very small children who will wake up from their naps at some point. So our big new priority, which goes a little bit into the environment, we'll be talking about this at the Eastern Shore Environmental Summit in January as well, but I wanted to highlight as the PFAS Protection Act. So if folks are not familiar with PFAS chemicals, these are a set of thousands of toxic chemicals that are pervasive in our environment and in consumer products that are putting our drinking water and public health at risk. We have a new page on our website about this campaign. We know that there is contamination of Maryland waterways, even though it's not required by law. We have independent testing that's found dangerously high levels of PFAS in some drinking water as well as seafood. And this is a big issue that we're going to need to be addressing over the long term, both to deal with testing and remediation and holding polluting industry accountable. This year, we're going to take a first step towards that with a pretty comprehensive bill that restricts the use and disposal of PFAS chemicals. So the bill we're working on with Delegate Love and Senator Elfreth will ban the use of PFAS chemicals in firefighting foam, and the state firefighters have endorsed the campaign because there's safer alternatives. And this is one of the major sources of pollution in our waterways is PFAS firefighting foam. It also restricts the use in food packaging. Testing has found PFAS in fast food packaging and food packaging for takeout items, which obviously can leach into the food. Food and water are the two main sources of public health harm from PFAS chemicals. And the third place that we're restricting it is in rugs and carpets. I believe Vermont, there's a couple states who've already done this, but obviously when it's in a rug or carpet that can leach into your environment, into the household dust, which puts children at risk, but also just the manufacture of rugs and carpets uses a lot of PFAS chemicals if they're trying to make them stain resistant, for example, and that can be discharged at the manufacturing site as well. And then the bill also restricts the disposal of PFAS chemicals. So it'll ban incineration of landfilling of mass quantities of PFAS chemicals. So for example, once we ban firefighting foam, it'll require that any foam that's in state will need to be kept until there's a safe disposal method. We found in other states that they've actually started incinerating it, which is pretty bad. These chemicals are highly persistent in the environment and bioaccumulate in your bodies, which is a dangerous combination. Another chemical like that you've probably heard of is lead. Once it's in the water, it's going to be there forever. And once it's in your body, it doesn't go away. So we want to make sure we're not burning it up and spewing it into our air through incineration or leaching it more into our landfills by landfilling it. And then, as I said, this is a big bill. We're taking on quite a lot. Every component of the bill has already been passed in another state, which we thought was important, especially because this session will, as the delegate said, be very different. We don't want to be getting out of control with something we can't handle being not in Annapolis. But longer term, we do have vision on adding additional provisions to ensure that the polluting industries who have put PFAS into our communities are being held responsible and ensuring we have a comprehensive testing strategy for the state. So that's down the road. Another big bill we're working on this year is right to repair. This has gotten some good attention nationally. We've worked with this. This bill was introduced last year on the day before I started my shelter in place. I think it was March 12th or 13th. So obviously the bill didn't get any votes. It was pretty rushed. But we're working with Senator Hester and Delegate Feldmark on this bill, as well as the Attorney General. What it does is it ensures consumers have the right to repair any electronic products they own. So the comparison is to cars. It used to be that you could only get your car repaired at the manufacturer or one of their registered dealerships, which was not good for consumers. They could rip you off, for example. But now you can get your car repaired anywhere. You can go to an independent repair shop because the independent repair shop has access to replacement parts and the schematics for how the car works. We're asking for basically the same thing for other electronic parts. Right now, because the manufacturers have a basic monopoly on repair, they can price gouge consumers by charging hundreds of dollars to replace a screen on your iPhone, for example, or refuse to replace it at all. Say, oh, we don't replace headphone jacks, and make you buy new, which is part of their design, right? So often they want to force people to buy new, which is obviously bad for consumers. It costs them more and is really bad for the environment because we are producing so much waste from these products. It's not just cell phones, although they're in some ways a poster child for this. It also applies to everything from tractors are a big thing. We found that a lot of farmers have had trouble where they do not have the access to update or fix their farm equipment, which means that they have to pay exorbitant fees to get a repair person out from a licensed dealership to come do repairs. And so they've been rallying with us for this bill. And then recently, and it also applies to medical supplies, which has become quite an issue during the COVID crisis. Fortunately, we haven't had a major issue that I know of in Maryland, but in other states, when ventilators are offline, they aren't able to get a repair tech there. If the technicians in the hospital don't have access to the instructions for how to repair and how a ventilator works, they can only rely on the manufacturers themselves, which it's not even safe for them to come into the hospital. So there's all these ventilators that should be repairable that are just sitting in back rooms because the repair techs don't have the tools they need. So this bill is a big lift, I think, but we're really pushing to get the different industries to either agree to provide this information to independent retailers or make them do so through legislation. And so I'm eager to be working on it again. And then to briefly touch on some of our elections work, a couple bills. One is the Student and Military Voter Empowerment Act. We worked on something similar to this last year. Its goal is to increase participation on college campuses, specifically by expanding access to voting and encouraging campuses to have a vote plan. It also increases access in military sites and gives all large institutions more tools to work with their local boards of election to have polling locations at their campus or at their military site or in their retirement home. This bill, actually, a version of it passed through the House last year, and it just didn't get through the Senate before we had to shut down. Similarly, the Maryland Fair Elections Act. This is one of our top priorities for years. We've been working with local communities to pass small donor public financing for local elections. This would update the gubernatorial public financing program to be similar to what we passed at the local levels. It passed through a couple committees in the Senate, but just didn't make it through before our session ended last year. So we're hoping this year is the year. And then we don't have specific bills yet on some of our other voter access work. The League might have more to say. But some of the ideas that we're backing and back last year is expanding access to voting and vote by mail by creating a permanent vote by mail list for anyone who wants to be on it, expanding automatic voter registration to more state agencies, and expanding some of the things we saw people like during this election. So
we have 1 minute left.
Okay, more drop boxes and more early voting. So early voting right up to election day. I think that's what I got. Again, I'll try to stick around at the end to answer any questions, but I'll put my contact information in the chat as well. Thanks so much for having me, Ed, and the entire Maryland Legislative Coalition.
Thank you, Emily. Thank you very much. Next up, we have Marceline White of the Maryland Consumer Rights Coalition. Where is she?
Good afternoon. Thank you all for having me here. I'm grateful to the coalition for having this event and having us all on to speak. Again, I'm Marceline White. I'm the Executive Director of the Maryland Consumer Rights Coalition, MCRC. And MCRC works to focus on economic rights and equity. And we do that through research, public policy advocacy, organizing, and direct service. So I'm just going to touch on a couple of our top priorities, and I'm happy to stick around for questions as well. I believe you have our one pager about our legislative agenda. So one of the things we're focusing on, again, looking at the twin crises of COVID-19 and the economic recession, is we're focusing on debt collection. In addition to the eviction crisis that everyone is concerned about and that we're working on, we're also expecting a debt collection tsunami where thousands and thousands of Marylanders have had to rely on credit cards or fallen behind on their bills, either because they've lost their job or lost their income or had other pressing economic needs at this point. So as part of that, we are working on a number of bills this session that affect both health cost and debt collection writ large. The first that I want to bring your attention to is the Medical Debt Protection Act, and that is sponsored by Delegate Lorik Charkoudian and Senator Brian Feldman. We introduced this bill last year, and we think it's even more pressing this year. It ran out of time at the end of last year's truncated session. But right now in Maryland, if you go to a hospital to seek care, the hospital can, and you can't pay your medical debt for whatever reason, the hospital can then pursue you with medical debt lawsuits. They can sue you on the debt you owe to the hospital. And then if the court finds in favor, which they do 98% of the time, they can put a lien on your home. They can put a lien on your car. They can garnish your wages, and they can zero out your bank account. So they can take all of the money out of your bank account because you went to the hospital for care. And Maryland clearly, as the General Assembly has asserted time and time again, wants to make sure low-income consumers are covered. So we have our total cost of care model. We have financial assistance policies in place. So we've been doing the work to try to make sure that folks are covered. But what we're finding are a couple things, and I'll put in the chat a report we did last year called Preying on Patients. What we found right now is that some hospitals are turning away between 25 and 50% of people who apply for financial assistance policies. So these are families who applied and are turned down. Many people didn't know the financial assistance policies existed. And so those are some of the issues we're seeing. The report we did last year with the AFL-CIO and National Nurses Union found over 10 years, about 145,000 people in Maryland were sued for medical debt lawsuit. The median debt they owed was under $1,000. So they owed about $945. So these are mainly affecting low-income families, people who can't put $1,000 on their credit card or can't get $1,000 from their own bank accounts or from families and friends to pay off this debt. So the Medical Debt Protection Bill is going to do several things. First, it's going to require hospitals to establish an income-based repayment plan with the patient before they can pursue a lawsuit. What we've seen in the past is sometimes there'll be a repayment plan, but the debt collector will just say, just give us $200 a month. And the person, rather than going to court, will agree. But obviously, it's not sustainable for many, many families, particularly now. So it says you have to create a payment plan that's based on their income. And once you've exhausted that method, then you can pursue a lawsuit. But it's also saying through the lawsuit that you cannot take someone's home or their car, which they need to get to work or to look for work, to pay off a medical debt. And finally, the goal is to prohibit medical debt collection at all for debts under $1,000. And just briefly, to put that in context, medical debts overall are only 4% of hospitals' income. So medical debt lawsuits under 1,000 are much less than that. So we believe, like many other hospitals in other states, they could forgive that or work through the payment plan method. So that's the medical debt protection lawsuit. We're talking to hospitals, Delegate Pena Melnick and others have been helpful as we're moving this forward. And that's going to take a big push. But especially given COVID and the long-term consequences in chronic health we see, we think it's particularly important, as well as the fact that a lot of these lawsuits are taking place in disproportionately low-income communities and communities of color. So we think it's an important bill. The next is something we worked on. I serve on the Attorney General's COVID and Access to Justice Task Force as co-chair of the Consumer Protection Committee. So the next piece we're working on is, again, with debt collection. We're working with Delegate Pam Queen. Maryland gets an F, and we're one of the lowest ranked states in all of the countries in terms of how much we protect people, low-income people in debt collection. So the bill will actually say that you can protect up to $2,600 in your bank account from debt collectors. And that is the equivalent of 2 months rent across the country. So it means they could take money out of your account, but that's a floor that we would be setting. And many other states already have some kind of floor protecting bank accounts. Maryland has no floor, so they can take everything out except for protected Social Security disability assets. So we'd be putting in a little bit of a floor on that bill, and that's supported by the AG, and Delegate Pam Queen will be leading that bill. We are also looking at the issues around high-cost auto insurance. As Delegate Pam Melnick noted, zip code often affects your life circumstances in Maryland, and where you live affects what you pay. And that's not right. And in auto insurance, there's been research showing that the more a community is majority minority or majority Black community, the higher their insurance rates are. And that's based on zip code. So this legislation would smooth out those differences and basically make sure that zip code cannot be, it basically caps the amount that your zip code can affect your auto insurance rate. So you'd focus more on your driving record, your number of accidents, things like that, as opposed to your zip code. So we're working with Senator Hayes and Delegate Alonzo Washington on that legislation. We're also working on student issues, more at the college level. As you know, COVID's affected many people, but for housing insecure and food insecure students and formerly homeless students, they are particularly vulnerable when COVID affected their ability to stay on campus. So there are two pieces of legislation. We're working with Senator Mary Washington and Deborah Davis, Delegate Deborah Davis. One is looking at homeless youth who have access through a grant system to go to college, but they have to recertify that they're homeless every year. So it's simply smoothing that process so that once they've verified they're homeless, they don't have to go through a lot of paperwork on their own every year to continue to have access to go to college. And the second just expands the idea of grant programs on college campuses for food insecure and housing insecure college students to help them have emergency financial needs met, which we've worked with college students across the state right now and are hearing from them in focus groups and surveys that many are really, really struggling at this time. So expanding the ability of the college and the state to help support those students. We're supporting eviction, but I think you're hearing about that from a lot of other people. So we're part of the Eviction Coalition, trying to protect people who are at risk of eviction. And I think I will stop there. So I can put the Preying on Patients report in the chat. I will be around for questions. And I can also make sure our legislative agenda is in the chat, as well as ways to reach out to me. And we'd love to work with everybody on all of these bills.
Thank you, Marceline. Next we have Tammy Bresnahan of the AARP.
Hi, good afternoon, everyone. I feel like I'm a little bit of a broken record because a lot of these things that I talked about during the coalition meeting last year, we are still working on this year. ARP has about 870,000 members across the state. And our founder, Ethel Percy Andrus, was a retired teacher who is famous for saying, what we do for all. So a lot of the things that we work on, because women sometimes outlive, in most cases outlive men. We work on issues that sometimes affect women more than they affect men. So the first bill that we will be supporting, and we have supported for the last 3 years, is called the Paid Family and Medical Leave Act, also called the Time to Care, and I am a part of the Time to Care Coalition. This is the 4th year that this bill has been in. Not to mention 1 year it was a task force, and we met for over a year with Delegate Kelly. This year it's sponsored by Delegate Ralderama in the House and Senator Hayes in the Senate. And it creates an insurance policy so that people can have paid leave if they need to take off. And one of the reasons that AARP supports this is because it allows caregivers who are caring for an older relative or parent to use that paid leave. The second bill that we will be supporting, it's not actually a bill, it's an override. So last year we supported the Prescription Drug Affordability Board funding mechanism, and it was one of the bills that Governor Hogan vetoed. He vetoed all bills with a fiscal note, while this bill would assess a fee to all pharmaceutical companies doing business in the state of Maryland by a percentage so that the board could actually do its work. And we will be supporting with the coalition that we've been working with, the Healthcare for All Coalition. We will be supporting an override the first couple of weeks of the session. Another area that we thought we would be working on, but I was told a couple of weeks ago that the sponsor wasn't quite interested in putting this legislation in. Assisted living reforms. I don't know how many of you are familiar with assisted living. Sometimes it gets lumped together with long-term care under nursing homes. Well, nursing homes and assisted living are regulated totally different. For example, nursing homes have to have a licensed administrator, and they have to have medical professionals who work in that facility. They're heavily regulated by the federal government and by the state government because they take a lot of federal funding and state funding. What you don't know is assisted living over the years has started to look a lot like nursing homes. There are about 1,400 assisted livings in the state of Maryland. And basically the only thing that's regulated is the size of the building and how many people they can have. There is no requirement for a licensed administrator, so you could have a high school diploma. You could have said that you took care of your grandparents. There is one requirement for them to have a nurse come in intermittently, but the people that take care of your loved ones don't even have to have a certified nursing assistant like they do in nursing homes. So we were working with the ombudsman and the State Board of Nursing Home Examiners last year that would require the licensure of the administrator. And the bill was withdrawn in February, and we were asked to put together a coalition, and we did that based on the sponsor. And then a couple of weeks ago, they told me that she had too many bills. And so we've been sort of regrouping and punting, but this is an issue that everyone should be concerned with. The total number of deaths due to COVID in Maryland is 2,478, which is more than 50% of the total deaths. So essentially what's happening is older people that are in assisted living and nursing homes, congregate care, are dying at a faster rate. I know that this is a pandemic. I know that it's unusual, but most facilities in the state of Maryland don't even have a week's worth of PPE. Now, what you might also know is that the federal government has given over $21 billion to nursing homes and assisted living to make sure that they have PPE. So we want to make sure that they use that. And we're asking the state, tell us, are they actually using the money that they're getting from taxpayer dollars for PPE? Are they paying their staff? That's the other thing, is that we know that these facilities don't have a lot of people who get paid very much money. They don't get sick leave. They're considered essential, but they don't have benefits. They often work from one facility to the next. And when you have community spread, then you have an issue where you have lots of COVID in congregate care with your grandma, with your grandpa, with your auntie and your uncle, or your mom or your dad. And we'd like to see the General Assembly really look at these issues and make sure that the people that we've entrusted to care for our moms and dads are actually licensed, that they know what they're doing, that they have some kind of medical background. We know that in assisted living, they have the highest acuity of people with brain disorders, some kind, dementia, memory loss, Alzheimer's. And they even advertise that they have memory care unit, but there's no requirement for them to have anyone who has any background in memory care or who has any healthcare background at all. So we're asking that the General Assembly look at this. We also know that during COVID, mental health has been an issue for older individuals. And when we started looking at mental health, and this is something that we just started a couple of months ago, we looked at that the lieutenant governor had a group that was working on mental health. There's another advisory group, but there really isn't any group that's actually looking at what's happening to older individuals. And they are our highest growing percentage of the population at this point. And so we'd like to look at mental health for older people. And then we will be working with the Maryland Healthcare Coalition on reducing healthcare disparities. There will be a bill introduced. I forget who the sponsors are. Someone else on the phone might know, but we will be working with the Healthcare Coalition. And then lastly, one of the things I think Delegate Pina Milnick mentioned was telehealth. And you can't have telehealth if you don't have access to broadband or your phone. And just a short stint this past week, our phone went down, our internet went down, and our phone went down. And it took me over a week to try and get someone to come out here. And I had 3 different individuals come out. And I can't imagine being an older person trying to use your hotspot on your phone to fire up, or to get someone to come out. But anyway, we will be supporting Delegate Brooke Lehrman's, it's called the Digital Connectivity Act of 2021. 33 other states have something similar. It creates an office, I think, within the Department of Housing that will look at why is there a disparity in broadband. It's the funniest thing. You can be in one place and walk next door and not have connectivity. Like Hyattsville, for example, they have a blackout spot, and it's close to the district line. It's within like an urban area or a suburban area. They still have big, massive blackouts that they cannot get access to broadband. So we have, we know that it's going to be an interesting session, but we have some things that we would love to get some people involved with. And, we're happy to take some questions.
Thank you, Tammy. That was very nice. Great presentation. Next up is Elaine Apter of the League of Women Voters of Maryland.
Hey, thank you very much for organizing this. It's a pleasure to be part of it again. I'm Elaine Apter, the Vice President of the League of Women Voters of Maryland. And I'm just going to share and talk to you a little bit about what our priorities and what we're working on with the election. As many of you know, the League of Women Voters, which has been around for 100 years, has basically 2 parts. One is the voter education, which is our voter's guide and Vote 411. But our other part is a process of study, consensus, and action. And that leads to positions that we can work on. And that's what I'm going to talk about today, is what we're looking at as far as the upcoming session. It's already been noted about the Maryland Fair Elections Act, and that's what we seem to see is the legislatures are looking at packages. And so our priorities are going to be voter access and protecting the vote. And we'll be looking at these legislative packages. As far as the following is concerned, redistricting reform has been our #1 for the past few years. Sadly to say, it didn't go through last session because of the shortened session, and it probably will not be up in this session, but if it does, we're ready. The other one, and it's been mentioned before, is getting incarcerated voters to be able to register and vote and get their mail-in ballots. And many of us have been doing this on a volunteer basis, going into detention centers and jails. But it really, we would love to see it mandated so it's done in-house. And we know that these eligible incarcerated voters will have every advantage to be able to vote. Ranked choice voting. We are part of the Ranked Choice Voting Coalition. We're working with them. I think many of you realize that, especially in primaries with a lot of candidates, you can get a candidate elected with something like 12% of the vote, which really isn't very acceptable. So we are going to be working and pushing towards ranked choice voting. Money in politics is always high on our list. The League believes in public funding, and also we're hoping that there are some transparency bills in these packages. So if we can't limit the amount of money in politics, at least we can know where this money is coming from. Another one that we just started pushing for, we got a position a few years ago, last year, is unaffiliated, allowing unaffiliated voters to vote in primary elections. More and more voters, especially young and new voters, are opting to be unaffiliated. They're not connecting with a party. This means that they cannot participate in partisan primary elections. So the League of Women Voters would like to see these unaffiliated voters be able to go to the polls and ask for a party primary ballot, one or the other, so that they can have their voice heard also in primary elections. We do not agree with the idea that somebody registered with a party can turn around and go up at election day and say, I want to change party. This is strictly for unaffiliated voters. If anybody wants to try change parties, you can do that, but within a certain time limit. The other one that has come up is vote by mail, and that is something that is on everybody's minds right now. And interestingly enough, the League of Women Voters is just completing a 2-year study of vote by mail. We were a little ahead of the game, not realizing how important it would be in the last 2 elections. As you know, we cannot advocate for anything unless we have consensus and a position. We are collecting the consensus data now. We might have a position by the legislative session if the League of Women Voters of Maryland goes for vote by mail. We understand probably this year what's going to be up is a look at vote by mail, a study by the legislation of vote by mail. And basically vote by mail, what we're talking about is all eligible voters automatically get mailed a ballot. There are limited polling places, and there are drop-off boxes, which are alternatives to mail in. And so what we found in our study is we spoke to a lot of people in the 4 states that already have vote by mail, and we spoke to some experts, quotes, in the field. And we found that some of the best practices are really best practices for elections around across the board. And so these are things that we can easily probably advocate already. And that is accurate voting rolls. That is expensive, important, whether you have vote by mail or whether you're just in general regular elections the way we do it now. Extensive voter education. This again is true, but if you're going to a different system, this is really very, very important. And we have to realize, I'm going to put kudos in for our local boards of elections and state board of elections, because like Oregon and Washington, they've been tweaking this for 10 years. Our boards of elections did it almost overnight. And yes, there were some problems, but we've learned from the problems, hopefully. And I just want to let you know how amazing it was that they did do as well as they did. One of the things that's very important, especially if you have limited voting places and not all precincts, is the access. And this has come up, because those that cannot use the vote by mail-in ballot are usually people with disabilities, such as the blind, that need technical help. Those of homeless that don't have an address to send to. They need to get to in-person polling places. The key is those polling places have to be accessible by mass transportation. And I know this was some of the problems in the last election. Those people can't jump in a car and drive 10 miles or 5 miles to a polling place. And the other thing is accessible and safe drop-off boxes. They have to be safe both for the ballot and for the voter that is going to use the drop-off box. So hopefully we can share what we have found with the legislators during this session, and we can share it with any of you as to the vote by mail process itself. And I know we're famous for our election, and that's what I'm supposed to talk about today, but we have organized other teams because in 100 years, we have a lot of issues over a lot of positions over a lot of issues. So I just want to let you know that we have teams working on transparency in government, progressive and adequate fiscal policy, public education, public transportation, police accountability, affordable housing, and clean energy. So if you're interested or want to work with us on any of those, let the League of Women Voters of Maryland know, and we will get you in contact with any of those teams. So I thank you.
Thank you, Elaine. Next up is Kimberly Haven from Reproductive Justice Inside.
Good afternoon, everyone. Thank you so much for joining us this afternoon. My name is Kimberly Haven. I am the Director of Reproductive Justice Inside. First of all, I've been watching the chat and I've been reading all of the comments about the voting. I can't wait to hear this conversation at the end of the presentation. I only have one piece of legislation that we are supporting and putting forth and leading this year. So I will be brief. I realize that it's 3 o'clock on a gorgeous Saturday afternoon, so I will try to be as succinct as I possibly can. Reproductive Justice Inside, and I'm hoping that my screen will work. We are a statewide coalition that advocates for increased access to quality sexual and reproductive health care for women and girls in Maryland's correctional and detention facilities. And we do this through a variety of different strategies, policy, organizing, and story collections to talk about these abysmal healthcare conditions that exist within our detaining facilities. This issue, a lot of people don't think about reproductive justice as part of larger criminal justice work, but it is. And these are just some kind of thoughts about what that is. And that is that our over-incarceration imposes special burdens on women and healthcare. Women have traditionally, historically, and still currently function as, and yet we are the fastest growing segment of our prison population. And so when our prison systems infringe on the right to reproductive health care and reproductive decision makings, it actually has a detrimental effect on the rights of an individual to parent with dignity. Currently, there is no oversight of the reproductive health care within our correctional facilities. There is no thought that this is something that needs to be done. We have subpar policies, and there is virtually no data collection and analysis. And so as this population continues to explode, there is going to be a very huge cost that we're going to end up having to pay on the back end. And it's important to note, then some of you have heard me say this before, there's a lot of friendly faces on this call, that 95% of the people that we incarcerate return to our communities. And so what we don't do to them, what we don't do for them, what we don't do with them is what they're going to bring back to our communities. And so 2020 came in like a wrecking ball, as everybody knows. We were all in Annapolis until the day that they said, guess what, you all have to leave, time to go home, and session ended. And so what happened with COVID was that it created a perfect storm. Pregnancy, incarceration, and COVID created a perfect storm for the increased medical risk and psychological trauma for incarcerated women and girls. And so what we found was that we had to pivot. And so no one was immune, and our prisons and our jails were in fact petri dishes. And so what we realized is that we needed to pivot and work with our community partners to advocate for and to not really advocate, to really fight for the needs for pregnant and incarcerated individuals during the pandemic. And so we were trying to find ways to decrease the risk of virus exposure, which obviously could impact pregnancy health care. We have been advocating for the release of eligible pregnant and post-pregnant individuals. And we were trying to help by connecting them to timely healthcare and harm reduction services. There is no safe way in our prisons and jails to social distance. There is limited to no PPE. They are given one mask. We are hearing about institutions where they're given a mask and then they don't get another one for a couple of months. There's no testing. There was a call, and some of the delegates that are on this call will remember that Secretary Green actually said that when he was asked when they had last done a large-scale testing at the Maryland Correctional Institution for Women, and he said he didn't know the date, but he would get back. And later that call, he said that they had done it November 14th and that they had done 500 people, which is virtually impossible to do in one day. And two, they hadn't been at MCIW since July. So we don't have any real facts and figures on what they're doing for the women that are currently incarcerated, and this also poses a significant health risk. Oh, sorry. So what do we know? So we know that prison is one of the worst places for anyone to be during the coronavirus outbreak, but it's especially unsafe for pregnant women. The conditions are dirty, the medical care is substandard, the healthcare professionals that are coming in and out to the community. They're locked down, that mental health stress that is being placed on the individual, because our entire prison population is basically in solitary confinement. And we know that 15 days or more is tantamount to torture. We've now been in lockdown for almost 9 months. And we need to look further at this. As Dr. Carolyn Suffren has said, we need to understand what the virus's impact on pregnancy looks like. The outbreaks that are happening in our prison facilities have already strained our healthcare ability to provide COVID-related healthcare, such as prenatal care. And so it's more important than ever that we make sure that that pregnant incarcerated individuals are getting released and that they are getting the community-based healthcare that they need. This is just one of the, I love making graphics and PowerPoints. But we also know that women in jail are more likely to have had a chronic condition, a disability, a cognitive disability, or, and this is key, mental health or substance use disorder. And so any of these coexisting health conditions already complicate pregnancies, but when you're incarcerated, it leads to higher pregnancy-related medical health care needs. Poor mental health is a huge challenge for pregnant women in prison or jail, and that the impact of being incarcerated with mental health issues causes new problems and creates existing ones to become even worse. For some reason, my little mouse doesn't want to work here. Currently, there is no coordinated care between public institutions, community-based providers. So the legislation that we're proposing will do that. It will set up a clear referral from the institutions and create a pathway that will lead to good maternal health outcomes. There is no transition right now between release and community-based healthcare, mental health, substance use programs. And women who are pregnant are absolutely at an increased high risk, and we need to make sure that this happens. People are being released on a daily basis without transition. It's even more dire when we're talking about somebody who is pregnant. Goodness gracious. While it is growing, the number is growing, it is important to recognize that if we fail to do this, that we are going to end up paying more on the back end. It would be smarter, it would be wiser, it would be good risk management to actually do things on the front end as opposed to on the back end. And all of the things that we are proposing to do would also help to reduce our rate of recidivism for this population. Goodness. I swear this worked earlier. There we go. Pregnant incarcerated individuals have healthcare needs that are not met by the system. And so what is the issue? So we already know that this is a vulnerable population, that they are preparing to be released. We are not talking about people that are being detained pre-trial. This is only for people that are sentenced and that are preparing to be released back into the community. So we need to build in supports that will provide a seamless set of care so that as she's preparing for release, if she is being referred to community-based partners for pregnancy-related health care, for mental health, for substance use, but more importantly, in the jurisdiction that she is going to return back to. Continuity of care would also prevent adverse health outcomes. It will also prevent unnecessary pregnancy complications. Additionally, pregnant inmates who present with substance use disorder must also be provided comprehensive assessments and offered medication-assisted treatment and mental health evaluations and care. And that's what our legislation does. It applies to all sentenced pregnant individuals who are being released. It requires that they will be offered prenatal testing and assessments to ensure the health of their pregnancy. It requires that they will be offered screening for mental health and substance use disorder, that before their release, the institution will arrange to have health insurance coverage to become effective and not later than 24 hours after her release. This is very easy to do because we know when people are going to be released. It requires that they make referrals to a quality reproductive health care provider that offers specialized services for pregnant and postpartum care in the jurisdiction that she will return to. And it requires that before their release, they make referrals to community-based mental health and substance use professionals. And not more than 10 calendar days after her release, she will be provided with a complete set of her medical records evaluated. Okay, I'm talking quicker, sorry. And that's what the name of the bill is. It is called the Pregnant Incarcerated Continuity of Care Act of 2021. This is how you contact us. See how close I got to the edge of that? I do want to touch real quickly that we introduced this last year, and prior to the session ending the way that it did, we were moving through both chambers. There was not legislative opposition. I saw this in the chat. Our opposition was from the Department of Public Safety and Correctional Services. Do the chair support? In 2020 they did. In 2021 we do not believe that that will waver, particularly in light of COVID and in light of the need to decarcerate our prisons and our jails. This is good risk management and it is good policy, and we look forward to having you support us.
Thank you,
Thank you.
Kimberly. Thank you. So before we move on to questions, just before then, I want to remind people that tomorrow we have a session on, first session is on economic justice. You need to sign up separately for each session. So if you sign up for this one, you need to go back and sign up for the one tomorrow. Tomorrow we have Public Justice Center, Maryland Center for Economic Policy, 1199 SEIU, Maryland AFL-CIO, Maryland Transit Equity Coalition, and Jews United for Justice. In the afternoon session, which is on education and health, we have Strong Schools, Maryland State Education Association, Maryland Citizens Health Initiative, Compassion and Choices, Maryland Family Health Network, and NARAL Pro-Choice. And now I will turn the program over to Jess, who will bring up the questions.
Okay, we're going to move on to questions right now. And
And you can cut me, all of them.
so for
Yes, you want
for Emily Scarr with PERG,
to acknowledge,
One
the
of-
delegates here?
sorry.
I'm sorry, do you want to acknowledge the delegates here?
Oh, I'm very sorry. Yes, I do. Thank you so much. I just would like to take this time again for all the delegates and who were able to join us again. Thank you to Delegate Pena Melnick for her presentation, and to Delegate Eric Ebersole and Delegate Sheila Ruth, Jen Terrassa, Terry Hill, and Ann Kaiser for joining us again today for this second session, and Aaron Mansour from Senator Lamb's office, and Brenda Wolf, who is the president for the Montgomery Board of Education, Montgomery County Board of Education. We're just very grateful that you could be here with us, and look forward to working with all of you during the legislative session along with these fantastic NGOs. Now with Emily Scarr with PERG, if one of the questions is synthetic turf fields are significant point source for PFAs. Why are we buying new ones when modern grass fields have comparable playability? Why do you think that they're being installed at such a rate?
I couldn't tell you the answer to that. I'm not an expert on the fields. I know that, there's a lot of controversy and folks have pushed against them. They're also on playgrounds, which I don't love with my little kids. So I know folks in the chat were talking about a couple bills on that. PFAS are and everything. And I think that synthetic turf is a problem too, because it's a lot of downcycled rubber. So you don't know what's in it at all. There's concern of injury for soccer players and goalies. So I know there's a bunch of folks working on that. The Sierra Club's been working on it on a couple bills in Maryland, and DC has passed some stuff. PFAS are in a lot of places. It's harder to regulate. Yeah. So we're looking at a couple things that have passed. I've supported those bills, and hopefully some of them move.
Well, one of the things that they were saying, how one of the questions that was being tossed around the chat room was artificial turf fields that do not use ground-up tires. Do they still have the PFAS? And yes, the PFAS are still in the plastic fields. They're using an extrusion process to keep plastic from sticking to itself during manufacturing. It's possibly a flame retardant. And many new tire infills are still plastic beads, plastic encapsulated sand, or shoe manufacturer waste, for example. Diane Conway was a particular person in the chat who shared a lot of valuable information. And I just wanted to let everybody know who's attending this presentation that the chat will be saved. It will be shared after the conclusion of our entire summit. And so all of the valuable information that people shared with the group you will be able to access that later. So thanks to Diane and everyone else who was sharing information about different topics. We really appreciate that. And back to you, Emily, one more question. Regarding the PFAS Protection Act, who are you getting the biggest pushback from, do you feel, at this point?
We haven't got a lot of pushback yet. This is one of the first public talks about it. So the opposition will be hearing about it soon. But I could anticipate that our number one opposition is the chemical industry, of course. They make a lot of money marketing these chemicals for all their useful product, usefulness, and shoes that were mentioned, their waterproofing abilities, their degreasing abilities. so that they can sell them to food packaging people. So your hamburger doesn't get your hands greasy or your salad dressing doesn't soak through the cardboard. And then I imagine that we'll see some opposition from trade associations, whether that's folks representing retailers or the grocery stores or food manufacturers. I don't know quite yet the volume, we'll see, but that's the folks I would anticipate would be the main opposition, with the American Chemistry Council, which is the chemical industries being the loudest opposition.
Thank you for that. Thank you for answering that. Marceline, we have two questions for you specifically. And someone asked if you could comment, if a person has Section 8 housing voucher and the landlord files for an eviction, you lose your voucher and you have to reapply, it becomes a stain on your record. Can you comment to that effect of what someone can do about that? And the second one is just not related to the first one, but will the medical debt protection plan cover undocumented residents or immigrants who are not eligible for the ACA? So if you could address the first and then the second.
Yep. So regarding the question on housing vouchers, the first thing I would say is that there is going to be legislation introduced this year looking at what the effect is on your credit report and on your housing report and availability. The source of income legislation in the past should be addressing some of that. And I will just mention that that our organization runs a program called the Fair Housing Action Center, which is addressing source of income and voucher issues, as well as tenant eviction protection services. So if you go to our website as well, or email me, I can put you in touch with our eviction prevention director, who can give you a much more detailed response about that particular topic, and if there are issues, what to advise clients or individuals to do. But there are some protections in place and some more coming and being introduced in Annapolis in this next session around eviction and what that does to your credit and other reports. Regarding the Medical Debt Protection Act, I can say two things. First, last year we were able to pass legislation with Delegate Robin Lewis and Senator Brian Feldman, which made sure that your immigration status could not be used and was not asked anymore in terms of getting financial assistance or support. We had found in the past that some hospitals were asking people about their immigration status, which obviously stopped people from pursuing and filling out the application. The issue we see more now, or we're hearing more anecdotally, are that individuals who are undocumented are not going to the hospital right now, even if they need treatment, because they're very worried about their status. So there needs to be more work raising awareness that they can't ask you for your status when you're asking for financial assistance. But they're also worried if they already have medical bills, they're worried about going and pursuing treatment. The new legislation applies to everyone. I will check to make sure that there's language that specifically clarifies that this is regardless of status, but the intent is that anyone who gets a medical bill would be protected by this.
Thank you so much for sharing that with us. Greatly appreciate it. Now, the next question can be answered by anyone, Sandy, Emily, Marceline, Tammy, Elaine, or Kim. The question people want to know is, do you have particular legislators that are leading the fight against, the bills that each of you are talking about, and or what is the major roadblock that we can productively target maybe for each of your bills? So if you can say that in a really short answer about, is it sponsored and is there a major roadblock that you see that we would need to focus on? And something that correlated to that, if you could answer it in the same, when you answer that, is if bills are favored by the committee chairs or not, if you would be aware of that at this point. I know not every bill has been assigned or given numbers yet, but Speaker Jones has said she'll let committee chairs lead priorities for the upcoming session. There is some concern that that would make it difficult for bills that are not in favor by a committee chair. So if you could, we will start with maybe Sandy or Emily or anyone who wants to start and just say, do you have support? Do you think the committee will support it? And what is your major roadblock in quick little increments?
Well, okay, I can go. So on our voting bills, that's the fair elections bill and the student voting bill. That's the easiest. I think we're in good shape. Although Chair Kaiser can speak up if she has an issue. Senator Pinsky is good on both those bills, and that one had moved out of both committees in the Senate. And then the student voting bill had moved all the way through the House last year. There are some updates to it, but I think those are supported by both committee chairs. I don't think there's any specific opposition. So I think I generally am more of like, show your support as opposed to going after anyone. We'll probably know more about swing votes as we get closer. On right to repair, it's a little bit more of a crapshoot since we haven't any votes yet. I felt pretty good about the finance chair's take on the bill from our hearing last year, but I don't know where the House Economic Matters chair stands. So folks want to ask him, that's helpful. And on PFAS, it's a brand new bill and it's really comprehensive. So I would not be surprised if we can move parts of the bill, but need to negotiate parts of it out, which would be okay in year one. It is a new issue to a lot of the legislature. So we definitely know we need to educate people about the public health concerns about PFAS, the need to regulate all of that. So we know it's a lot to bite off, and we're ready to compromise where we need to, but we didn't want to like just start with a small bill. As people said, this bill is even way bigger than we're taking on. So I don't know if it addresses their questions. And that one, we don't even know exactly which committee it's going to be assigned to yet.
Okay.
It might be an EHE and in I can't even remember, HGO, but I'm not sure yet.
Thank you. Thanks for that. And also when we ask about roadblocks, we're not necessarily saying like, do you think, Senator Bob's going to shut it down and we need to go after him? Yeah. It was more so just, do you think it's going to be the fiscal note? Like you said, it's so comprehensive, maybe only parts of it will go through. What are the major roadblocks?
I don't think any of these have major fiscal notes. It's industry opposition. That's that's what we do.
Right.
To the big guys. So on right to repair, there is some big opposition. You got Apple against you. John Deere, we got some big wigs who showed up in Minneapolis last year to lobby against the bill. So I don't expect them to back down.
Right. Well, thank you. Thank you so much. Marceline, do you have anything?
I do. So on the medical debt protection bill, that's going to HGO and to finance. And Delegate Peña-Monaco has already been supportive, and we'll be looking to her for support, continued support on this bill. We are talking to the Hospital Association, and we're making progress. My sense is that the biggest opposition will be to the piece around banning medical debt lawsuits under $1,000. We think there'll be opposition to that, and obviously, the hospitals have a lot of heavy hitters. Johns Hopkins has a lot of heavy hitters who they'll hire separately. It'll be industry lobbying. So medical debt stories is actually something we could use if people in the coalition have stories they could share about medical debts and what that's done to them, or can share, can promote that. That'll be very helpful. The committees want to get something done, especially in light of COVID. So we think we'll see some movement. On the protection of bank accounts, keeping something in the bank accounts from debt collection. The good news is some debt collectors have already agreed in concept that something should be protected. So that's a lot farther than we've been in the past. The AG is supporting the bill. The issue is going to be how much. Do we protect $100 or do we protect a couple thousand? It's going to go through Economic Matters. That is always a very difficult committee in general to move progressive economic legislation through. So I think folks talking, if you have members in Economic Matters or you have relationships, really making sure that this issue gets some hearing from all of the legislators there will be important. And then the work we're doing on students, the issue of the grants is going to be a fiscal note issue. If the schools provide grants to low income, students in need of housing and food, what number is that going to look like, and where does the money come from this year? I think that's going to be the big issue on that bill.
Thank you. Thank you so much for that. It's helpful to know where we might have to put in some extra work to get things through that are important to us this year. So Tammy, if you're still there with AARP, is there any bills that are you there?
So when I first talked about or spoke about the Family Leave Act, also called Time to Care, like Marceline, it goes through Economic Matters and Finance, and that they're very tough committees. Like I said, it's been in 4 years. The chamber is our chamber, and small business have historically been our opposition. However, there are a lot of small businesses. We had daycare providers, coffee shops come in because, you know, when their employees get sick, they can't go to work. And when they can't go to work, they don't get paid. And so they've thought that this was a good, you know, so we could use all the help we can get. On assisted living, we are up against a behemoth industry who has been, since all COVID started, they have been wanting they've been wanting the state and the federal government to stabilize them versus, you know, transparency and making sure that we know that the money's going where it's supposed to be going, and that, you know, they are adamantly against licensure. Last year, there were 2 bills in, one in the House and the Senate, and the House chair in HGO didn't want to move forward because there was too much opposition. This year, I'd like to say, you know, we need to protect the people that are in assisted living and nursing homes, and we need to do that any way we can. And it doesn't matter what the end is, it's that we need the best people working with our elders. They're our moms, our dads, our grandmas. So that's about all I have for all those. Thanks, Jess.
Sure. Thanks, Tammy. I know you're really passionate about elder abuse and preventing that. And I really look forward to working with you this session again.
Thank you.
You're mute, Jess, you're muted.
Sorry, very good at muting myself in a meeting. It's become a knee-jerk reaction, I think. I pause, I mute myself. Okay. So Kim, with reproductive justice inside, do you have any, can you just address the questions that I just went with? And Elaine, I am sharing you, saving you towards the end, you and Sandy, because of the discussions and chatter. So Kim?
Yes, our bill sponsor is Wanika Fisher, and we have the support in the House as a priority issue. We go through JPR in the Senate and judicial proceedings and judiciary. And in the Senate, our problem is going to come up with the Department of Public Safety and Correctional Services, as it always is. They don't like to have anything, they don't want us to prescribe anything, which is not what this bill would do. But if there is a concentrated and concerted effort on decarceration and certainly on protecting pregnant individuals, then this is good policy. So we need some help with public safety.
All right, thank you. Thank you for highlighting that for us. Sandy, do you have anything that you would like to address in particular about the bills that Delegate Penny-Melnick presented? Obviously, they have the support of Delegate Penny-Melnick behind them.
Right, that's what I was going to say, that they have her support, and you know, we can't get a much better advocate than that. The other thing that I had talked about we would support would be the Maryland legislative agenda for women, and they presented in an earlier session. And
yeah, this morning.
As
right.
she said, the agenda is not finalized yet. You know, the members all get to vote on it. So I can't really speak to it yet because I don't even know exactly what bills will be in it. But
okay, well, thank you. And I have one more. I have 2 more questions here. Elaine, this is a little bit to you. There's in the elections, we had a lot of chatter in the chat, Zoom chat. Oh, good. Hold on one second. I thought I muted myself again. So specifically in regard to unaffiliated voters being able to vote in the primaries or not, it got a lot of traction in the room. But is there a particular question or a particular statement that you maybe just want to address. I saw you share some valuable information in the chat as well that we'll share later. Was there a particular question or something that you'd like to maybe make a note of and just make a statement on for the group here?
Just general, I think a lot of opinions kind of correlate with age. Those older, shall we say, voters that have grown up with a strong political party system really are in favor of that, whereas the younger voters are definitely more in line of the unaffiliated. And we've been working for a few years now on this idea of letting the parties have unaffiliated voters vote in there. But it is, we have found that it's definitely an age in some ways related topic, which is interesting. And I noticed I did put in our primary election fact sheet in the chat, which goes into all this, because the league did have a position on closed primaries. And we were told, not told, but the state league voted to look at it again, and the league position switched to open primaries, which is interesting after doing the study. So yeah, there are times when sometimes situations change.
Right. As people grow with education and more knowledge, then they can change their views, become more open. You would hope that for everyone, Elaine.
I think, you know, and we look at our positions every other year to see if they're still valid, and this one was questioned. But I can understand where people that are really involved with the party and the party platforms are afraid of people doing crossover. And as I said before, any bills that we looked at would definitely prevent an immediate crossover. And let's face it, anybody can change their party at any time up until, I think, 60 days, 30 days before the election. So.
Right. And you shared a lot of great information in the chat. And we also have your one-page priority legislation that we'll be sharing with all of the attendees. Just to serve you the same question that everybody else answered, do you, do you have some legislators that are already backing you? And what do you see as being your primary roadblock this session?
Well, I think I agree with Emily on this because we're working on voter access and voting rights. I have to say Maryland is really up there as doing very well in that situation. So usually in that realm and with the Fair Elections Act, we really don't get into too much as far as the opposition goes. We're in pretty good shape. I think there, we're just looking at, because most of them are looking at big packages, we're just looking at the individual parts of the package to see. But yeah, I don't think we have the opposition that some of the other people that are working on things have.
Well, thank you. Thank you so much, Elaine. And I just want to read one question real quick out of the chat that went to Kim again from Reproductive Justice Inside. It was a question we actually got during our opening panel as well, in reference to the Women's Pre-Release Center and the veto override. People were asking questions about it. MLaw stated it wasn't a presentation that they saw, but it was something they supported in the past, and they more than likely were going to support that override. The question was, will it be, will the Reproductive Justice Inside be supporting that? And Kim did answer it, but if you could answer that just real quick for the everybody in attendance here, I think that's important.
Yes, we will be supporting it. It will go up for a veto override, and we do believe that we have the votes necessary in order to mount that override. The men have 9, women have 0. The fiscal note and the fiscal note conversations have always been what they've been able to use to not act on it. but we had overwhelming support last legislative session. And so we do think that we will absolutely get the veto override this year.
That's excellent, excellent news. It's always great to hear. So wonderful news. And I'm going to thank everyone for answering all the questions. We think we got through everybody's questions. As always, presentations are amazing. I'm going to turn it back over to Ed Johnson. Thank you again, everyone. Really enjoyed it.
Thank
Good
you
job.
for doing an amazing job with the questions. You're doing a fabulous job with those. And we're actually ending almost exactly right on time. Amazing. So I thank everyone I hope everyone found this instructive and useful. I thank the presenters for coming out and taking the time to present their legislation. And we look forward to seeing everyone tomorrow.
Thank you.
Thank you.
Thank
you.
you.
Thank you to everyone.
Thanks.